get started, welcome to the Mental Health Considerations theme. Children who have experienced loss, separation, and trauma may have a mental health diagnosis. This theme focuses on issues surrounding mental health. We'll start by building our understanding of mental health issues. Then we'll talk about diagnoses that are common among children who have experienced loss, separation, and trauma. Next, we'll discuss the role of parents in addressing mental health issues. It is normal and healthy or adaptive for a child's life experience to dramatically impact their behavior. Concerning behaviors can often lead to mis- or overdiagnosing without considering the impact of loss, trauma, and environmental stressors that influence children's mental health. Any or all of the 7 core issues may be stemming from the child's core experience of loss. Behaviors resulting from any of the 7 core issues are important to consider before making any mental health diagnoses. Trauma that happens between people needs healing through relationships between people. Support and trained, competent professionals in grief and trauma can make all the difference. Let's start by building our understanding of mental health issues. Being diagnosed with a mental health issue is not a life sentence. A diagnosis can help identify a child's needs and appropriate services. About behaviors you might see from children with experiences of separation, loss, and trauma that would concern you. This slide shows a few examples. When we describe behaviors in children, internalizing behaviors focus inward. Fearfulness, shutting down, and body complaints like stomach aches. Externalizing behaviors are directed outward, such as fighting or breaking things or running away. Some behaviors, such as moodiness, nightmares, crying, and hoarding, can be either internalizing or externalizing, depending on how they play out. Take a look at some internalizing behaviors: not telling the truth, withdrawing or shutting down, sadness or cheerfulness, moodiness, nightmares or trouble sleeping, toileting problems, frequent headaches and/or stomach aches, cutting, and other self-harm, clinginess, peer problems, inability to make or keep friends. Remember that behaviors may be internalizing or externalizing depending on how they play out. Now let's take a look at some externalizing behaviors: crying at surprising times, hoarding property and/or food, fighting, angry outbursts, cursing, saying shocking things, breaking things, hitting people with no provocation, promiscuity, drug or alcohol use, and running away. So why do you think these behaviors would be challenging to a parent? Which of these behaviors would be the most concerning to you, and why? And how do you see the backgrounds of the children who have experienced separation, loss, and trauma affecting how they behave? These are questions to think about while you are contemplating parenting a child from hard places. At what point do you think you would seek professional support around these? Early and often is what we recommend, because these behaviors can be concerning and challenging, and they may or may not result in a mental health diagnosis. In any case, stable, nurturing parenting will go a long way to help. What do you think parents can do to support children when they are experiencing mental health concerns? It's important to understand how layered our children's needs are so that we can put together a strong treatment team who understands the complexities. All assessments for treatment should include understanding the child's trauma and attachment history, loss and grief, physical impacts, and environmental impacts. Let's look at trauma and attachment history. The children you will be caring for may have experienced trauma to their bodies. This will impact how they think and feel about themselves and how they respond to situations and people. It will include trauma to their heart and mind because they were not protected. They did not feel cherished by the people who were supposed to care for them. And this will change the way children think about and feel about relationships. Their ability to trust in and be in relationships with others has been affected. These internal experiences, thoughts, and feelings may be expressed in behaviors that, on the outside, can be confusing, even to professionals. Now let's discuss loss and grief. Loss is considered to be at the center of the core issues that children in adoption experience over a lifetime. As we know, they have lost their culture, family and family history, in some cases friends, other caregivers, and what they believed was normal, such as parenting a sibling. Now, physical impacts. There are also physiological things to consider, such as prenatal drug and alcohol exposure, developmental delays, and sensory sensitivities. Finally, environmental impacts. It's important not to forget that there are critical environmental impacts to consider, such as how a child did or does in different settings, such as school versus daycare versus home versus with different caregivers, and how cultural context may weigh in. Do people look, seem, eat, act, live, or dress differently than what they are used to?